But in those resources, we are falling short on some needs, such as health care. More specifically, health care to those who suffer from neuromuscular diseases such as muscular dystrophy. Today I'm going to tell you what muscular dystrophy is, what the need is in our area, and how your support can help us bring help to the people who need it here. I have suffered from muscular dystrophy for many years, and so I know what the need is. I know how valuable support is. With a little bit of help from all of you, we can bring support to our area. So first, let me tell you a little bit about muscular dystrophy. According to World Book Encyclopedia, muscular dystrophy is defined as a progression in the muscles that weaken the muscles that provide the skeletal support for your body. So that means you get weaker over time. You can no longer stand, rise, climb stairs. It leads to disability. Muscular dystrophy affects children and adults, male and female. There is no one person who cannot be affected by muscular dystrophy. It's a progressive, debilitating disease that gets worse over time and eventually leads to disability and sometimes death. There is no cure for muscular dystrophy. According to the Center for Disease Control, in 2007, males who suffered from Duchenne muscular dystrophy, over 58% of them died by the time they were 24. According to the Mayo Clinic, signs and symptoms of muscular dystrophy vary according to what type you have and when it is diagnosed. The main sign of muscular dystrophy is progressive muscle weakness. Other signs include frequent falls, the inability to climb stairs, a hard time rising when you're sitting down, and a waddling gait, which means when you walk, your muscles and your hips are weak, so you kind of waddle like a duck. Eventually, the weakness leads to disability, and in some cases, the heart and lungs are affected, which your heart and lungs are also muscles, and that can lead to death because you can no longer breathe or your heart can no longer function. Okay, now that you know what muscular dystrophy is, let me tell you why we need help in this area. Western North Dakota has limited resources for muscular dystrophy or neuromuscular diseases. The closest closest clinic for MDA is in Fargo, which is over 6 hours away. The closest chapter of the MDA is in Billings, over 300 miles away. When I had surgery at a local hospital, they had to do research in order to treat me. Now, they did a great job, but without researching, they didn't know that I couldn't have certain anesthesias because it would seize up my lungs. They didn't know that they had to have a ventilator ready because I could stop breathing. They didn't know that they had to contact my insurance because it would take me longer to recover. I would have a longer stay in the hospital. And they didn't know to advise me that my recovery was going to be longer than anybody else. They didn't know how to treat me. That's where Muscular Dystrophy Association comes in. The MDA is a nonprofit health organization that has over 200 clinics in the United States and Puerto Rico. They train doctors for neuromuscular diseases. They provide equipment to people regardless of insurance, such as wheelchairs, walkers, canes, plus transitional devices, because when you have a disease like this, everyday things get hard, such as putting on your shoes or moving flights of stairs in your house. I mean, if you live somewhere, you don't necessarily have the ability to move. You have to make your house livable, and Muscular Dystrophy Association helps with that. According to the Muscular Dystrophy Association, they are currently working on over 250 research grants to help get treatment and cures for patients with neuromuscular diseases. And the most important thing to me that they provide is support groups. If you have never had a disease like this, it is not something that I can explain to you. So the support coming from trained professionals and people who are going through the same things you are is tremendous. You could not get through it without that. Now that I have your attention, let me tell you how you can help. By providing your support, you help people who struggle with everyday activities. The first step in any battle is making people aware of what needs to be done. Educate yourself further on the subject. I brought a lot of fact sheets here today. I can't, in this little speech, I can't give you information that you need. So educate yourself. Ask me questions. If I don't have the answer, I can get you the information. Once you are committed and you think this is something that is worthwhile, start telling other people about it. The more people who know, the more people who can help. The more help we get, the further we can go. If you feel strongly about it, ask me how you can contact your legislators, because they are working on bills for funding to keep this research going so that we can continue to find a cure and continue to improve treatments and bring resources to our area. Most importantly, don't be afraid to ask, what can I do? Even if it's something small, there's something you can do. Now that you know how you can make a difference, let me review. Western North Dakota needs a chapter of the Muscular Dystrophy Association, or at least some resources available to us. Now you know what muscular dystrophy is. Now you know what we're facing and what limited resources we have, and you know how we can help. And I urge you just to ask questions. Again, educate yourself. If you feel that you can be of any help, or if you feel you just want to be a voice, talk to me and let me help you go further with that so we can bring help to people here in this area who need it. Thank you for listening.